Are you going?
Good afternoon, guys. Thank you very much for coming. I wanted to introduce Dr. Schneider, who is a dear friend, my mentor. She's done her training at the University of Pittsburgh, not only her medical school and residency, but she was also the former chair at the University of Rochester, where I trained, and she was also the former chair of the American College of Emergency Physicians. We're very excited to have her here. I know that she's doing a talk on leadership, and there is nobody better to do this, in my opinion, than her. So please give a warm introduction to Dr. Schneider.
I'm so short. Thank you so much for coming. I appreciate it. I look out at you with such envy because you're beginning a journey that I'm ending or probably going to have to end it someday. And I will guarantee you that this is the most exciting journey that you will ever do in your life. Becoming a physician, especially those of you who are going to follow what I did and become an emergency physician, it is just unbelievable. No one else gets to do what we do. No one else gets to be involved excuse me, in patients' lives the way we are. I'm so lucky to have done this. I'm so lucky to have been involved in the training of 400 now residents who I call my children, not pejoratively, but the residents are the best children in the world. They come, they stay for 3 years, and they go away. But they come in, knowing a fair amount, but not knowing so much. And when they leave, they are such competent physicians. It's just been fun. So what I want to talk to you about is sort of what's next and what it's going to be like and something about leadership. And as Steve mentioned, I've been very lucky to have been involved with ACEP and several other organizations and to lead them. And so I have sort of a take on leadership, which I'll talk about. So to date, your life has all been about taking tests, about getting the best score, knowing the answer, and when you go into the next couple of years, it's all going to be about, you're really good with your hands or you're doing procedures, and you will become very captivated by that, and that will continue on through residency. But for the rest of your life, that's not important. Knowing the answers, really doing well on tests, as long as you pass, nobody cares, okay, what you get after you get that wonderful diploma and that residency certificate. And it's wonderful because then you can learn what you want to learn and you can apply the stuff that you learned. So what you're going to do with the bulk of your life after these few years are over, and I know they seem like really long years now, but really, quite frankly, when you're on my end of the thing, it was like a blip. Oh yeah, I guess I was in medical school. I think I remember that. And residency is a total blur because you get no sleep, so it's like having a baby. You get no sleep, you don't remember it, and so it couldn't have been that painful. But once you're out, and it was, once you're out and you're practicing medicine, it really is about leadership and what you want to do with your life. All right? And so I want to talk to you a little bit about what it's going to be like to be a doctor, all right? And what are the things that people are going to expect of you? Right now it's taking tests, getting scores. In the future it's going to be, most important thing is going to be, do you come on time to work? Okay, especially if you're an emergency physician, right? The worst thing in the world is to have your relief show up like several hours later, okay? I slept in this morning. Yeah, that's like, you need to be on time. Even if you're in an office practice, you need to be on time because people are relying on you and other people are there. You need to be low maintenance. Actually, this works well in residency as well, these first two. All right, if you are high maintenance, if you are very demanding, if you are somebody that needs, their white coat starched and hung on the hook and their newspaper folded in quarters and sat right beside, you're just not going to make it. All right, you're never going to get anybody to do it. And more today, you need to be a team player. Especially in emergency medicine, this is a team sport, but all of medicine has become a team sport. There are no more lone wolves, all right? Your staff, your nurses, etc. The most important person for you during your residency is the nurse on the floor, okay? Because they will either make your life wonderful or total hell. And if you're not nice to that nurse, it will be hell. Okay? They don't ask for much. Respect. Respect for their knowledge and their years of experience. You come in as a resident and you've had experience for all of what, maybe a couple hours. You've had your MD for a few days, and you know it all, right? And that nurse has been there for 40 years, and she's had a whole lot of you under her skin, and she knows what to do. And so you need to recognize that and treat her as someone who has been there for 40 some years. You need to follow the rules. There are rules, same. Your staff relations, your patient relations are really important, and your efficiency is really important, no matter what branch of medicine you go to. Notice there's nothing in here about test scores. Notice there's nothing in here really about how smart you are. And there's actually not, as long as you can kind of do the procedure and not kill anybody, it's actually not that important of whether you can do it in 2 minutes or whether it takes you 5 minutes, okay? And whether your stitches are evenly placed or whether they're a little sloppy, or whether your knots are square or maybe not so square, okay? So all the things you learn kind of go away as being important. But every physician is a leader. So there was a really interesting interview with a woman by the name of Megan Rainey just about 2 days ago. Megan was in, I'm trying to remember what city she's in. She's in Seattle. And they asked her to speak about the recent shootings in San Bernardino, because she is a gun violence expert. And her thing is, she likes her guns. I mean, she has guns, and her family's all military, they have guns. But she's like, cars are safe now, and safer now, and still as many people have them, but they don't kill as many people, and not so many people get killed. So if we did the same thing with guns, it would be fun. And so she's speaking, and this reporter is sitting there talking to her, and all of a sudden he says, "You're a human being. You have a family. I never thought about doctors having a family. I never thought that they were you must go home at night." And she said, "Yeah, I have a kid. I go home, I make dinner." He's like, "Oh my God, I never thought of that." Now this is like a 50-year-old reporter, okay? So no matter what you do, society is going to put you on some kind of pedestal, whether you deserve it or not, whether you like it or not, and you will be the doctor. And you'll be the doctor in the community, you'll be the doctor in your church, you'll be the doctor in every place you go, you're going to be the doctor. And people will look at you, and if you act as something less than a doctor, they're going to say, "What's wrong with the doctor? Look at that. Do you see what the doctor has on? That doctor's doing something bizarre." And you no longer are Sandy. You're the doctor. So you're going to be a leader. So let me talk a lot today about leadership. So what is it that you're going to need? Again, regardless of what you go into, some things are just absolutely given. You must be honest, you must be professional, you must have integrity. You're going to make mistakes. I'm sorry, you're human. Even if the world doesn't think that, you're going to make mistakes, and you got to own up to those mistakes. Okay? You've got to. If you didn't feel the spleen on that patient with mono, and the professor said, "Did you feel the spleen?" You've got to say, "No, I didn't." Okay? Because chances are it wasn't there anyhow. All right? So you've got to be honest, you've got to be professional at all times, and you've got to realize how society is going to look at you. You've got to have the best communication skills, and you've got to be on all the time. So what I tell people, I don't know if I told Steve this, but when I tell a lot of residents who are struggling, and he never struggled, but what I tell them is, pretend you're going on to be a play. When you walk in that door, you're an actor. You're personifying a doctor with all the skills and capabilities that you can have, and you are on, and you're going to act that part until you walk out at the end of your shift. And I know you're having a bad day, and I know your dog just died, and I know that you wrecked your car, and you're going to come in and you're going to act just the same way as if you were watching a Broadway play, and you don't want to hear the lead actor say, "It's not going to be a real good play tonight." Because, I wrecked the car on the way in. I mean, it was bad, right? My supper was burned. Okay. So you're on, and you're on in a very professional way. You need to know how to do research. Now, this is one that is kind of screwy because, surely she's kidding. But everything that you do that you want to have changed, you're actually going to have to prove to somebody. And proving something to somebody is research. I'm not asking you to do NIH, crazy research, but you got to know how to handle data. So, what if your administration wants you to add an extra doctor and put them out in triage? I mean, you got to look at that. You've got to study that. What if should you add an additional person when you're working in the ED? What if you're starting to board patients and you want to prove to people that this is a bad thing to keep patients for long periods of time in the emergency department while they're waiting for a bed? It's called boarding. All right, and you have to be able to prove it. You have to be able to prove, maybe it's your schedule really sucks. All right, and you want to tell somebody it really sucks. Well, you can go in and say my schedule sucks, and I'm going to say to you as a former chair, tough. But if your schedule is worse than everybody else's and has been worse for 6 months, then I'm going to say okay. And that's research, and that's one of the reasons you learn research. So you need to just know how to use research to win an argument. Leadership. I'm going to spend most of the rest of the time talking about leadership. One of the things the military has done is said every personality type can be a leader. It's not what we usually think. We usually think, there's like these charismatic people and they're leaders, they're born leaders, etc. But the military says they can make a leader out of any person, no matter what their skill set is. And they actually look at that and say there are sort of 3 main types of people. There are people who are competitive. That'd be me. All right, I make everything into a competition. I actually have to learn to tone down my competitiveness, because I will, if I get my competitive edge out, I will take you out. I don't care what we're doing. If it's like getting to the end of the hall, or if it's eating faster, or if it's whatever it is, I will take you out. So I have to tone it down just a little bit, but I'm extraordinarily competitive, all right? There are collaborative people who build consensus, and then there are cooperative people who will just go along with the flow. All of those people make great leaders. So you need to learn how to do it. And the way to do it is to have into your head what you want to accomplish. There's a Yogi Berra statement. I never do Yogi Berra, okay? But Yogi Berra, who recently died, I guess, once said, if you don't know where you're going, you won't know when you get there. You need to know what you want to do. Are you going to have a great shift today? Are you going to really rock this residency? Are you going to take charge of this patient and care about them? And that's the decisions you're going to do, and you're going to move your whole team with you, because you're the physician, you're a leader. The leader is visionary. They need to understand how to plan. They need to understand we're not there today. Our emergency department or our office isn't quite right. But we're going to get to this point. We're going to get to the place where the patients have a great experience. We're going to get to the place where we're efficient. We're going to get to the place where we make more money. Whatever it is you want to do, you're going to take your team with you. You need to think at a systems level. It's not just about that patient that's in front of you. It's about what brought that patient to you. It's about how the people get to you, what happens afterwards. As an emergency physician, we see this like tiny little slice of the person's life, itty bitty slice. But we have to think about, are they going to go home to a home? All right, are they going to be able to get their medicines when they go home? Are they going to take their medicines when they go home? Is somebody going to take care of them? If we don't take care of that, then the whole thing falls apart. They may as well not have come to us. You have to manage your resources. Again, regardless of what department you're in or where you're at, you're responsible. You can't just go ahead and willy-nilly order tests, hey, that sounds like a good test, maybe we'll just add that on, okay? I once had a patient, I like to tell stories. So it's New Year's Eve, I'm depressed, it's 11:50. Okay, I'm at the VA, I'm a resident. And at the residents at the VA have to draw their own bloods, or at least they did. And so I walk in to see this guy, and my senior resident said, I'm going to bed, draw every blood test you can think of that would be pertinent to this guy, and then go to, and we'll work him up. I'm like, I go in, the guy's got a fever, all right? That's all he's got. And I have all these blood tubes in my hand, and they're all different colors, and they're in a circle. And I happen to see that the blood culture tube is a yellow tube. And when I put the yellow tube in the middle of the circle, it made a flower. And it was so cute. It was just a nice little flower, okay? So I took the flower in and I drew a blood culture on this man who had a really low-grade fever. Oh no, excuse me, he didn't even have a fever, he was anemic. He didn't have a fever at all, he was anemic. But I took the flower in and I wasn't really paying attention. It was midnight, they were playing Old Lang Syne on the, thing, and I was, pissed. So I drew the blood culture because it made a flower. And he had a positive blood culture, and he ended up having something known as subacute bacterial endocarditis, which some of you will know about, right? And then I had to, as the resident who had made this obscure diagnosis on the basis of anemia only, had to present this case 5 times, and every time someone asked me why I drew the blood culture, and I couldn't tell them it was because it made a flower, I had to say to them, I was once told that if a patient had an unexplained anemia, that you had to think about SBE. And every time the guy would say, well, I guess that's true, Anyhow, so whenever I think about, I'm just going to do it, or one of the residents says, I will just throw in a little, can't hurt. I think about the flower and the lesson that taught me of the danger, because 5 times I had to think how I was going to get out of that stupid question and not, it was a pretty flower. You're going to be hiring people, so you have to be a talent scout. You're going to be a mentor. You're going to be a mentor to young people who come to see you, whether it's in the emergency department or in your office. There will be a ton of young people who come in and see you. Some of those people will end up being physicians, and you can play a huge part in that. I cannot tell you the number of young people, number of physicians who have come, as we tell our story about how'd you get into medicine, have said, I never thought about being a doctor. It sounded like, I didn't think I could do it. And then somebody came and said, why don't you become a doctor? You're pretty smart. You could do it. Having someone just say that one time to you can change a life. So I tell it to everybody I can think of. Okay? Because what harm could it do? Little kids playing with my stethoscope. You could be a doctor, You never know when you can change a life. And you are, one of the other pieces is a network builder, and one of the jokes around Rochester used to be that I knew everybody, and they used to try to find people. They'd say we'll find a medical center, and I'd always know somebody there. But it's really important to build your network, not just so you get known, but because you will learn from those people. So you can say, what do you guys do with, we're having a problem with getting the nurses to draw blood cultures. How do you do it? What do you do with an Ebola patient? How do you handle a patient that has hepatitis C? Are you using that new medicine? If you don't have that network, you can't do it. You have to understand also your vision for what's going to happen in your own area and in the institution. All right? You're all going to be in some way affiliated with a hospital or a bigger institution. You need to know what they're thinking as well as what you're thinking, because if your visions don't align, it's not going to work well. And so you need to be very comfortable in understanding what's going on. You really have to understand crisis management. Things happen. Another one of my children just walked into the room. So you really have to understand crisis management. When something happens, whether it's Ebola, whether it's someone in the department getting hurt, whether it's which was me, what happened to me, it wasn't me. My head of pediatric emergency medicine was arrested for child pornography. Think about that for a minute. The head of pediatric emergency medicine was arrested for child pornography. And he was my very close friend. And I had to step back and be the leader and manage the crisis. And then I would go home and melt. And then I would go back and I would handle that. So you got to be good at that. And it happens, somebody in the staff or somebody in the staff's family gets hurt or killed or commits suicide. You end up having to be that person. You can melt down later, and you can melt down a little bit, but you still have to be the leader. You're perceived, and people will look at you. If you lose it badly, you can cry, but if you lose it badly, then the whole thing goes apart, okay? You can't do it. You have to be the voice of hope. This will get better. This is a voice to both your staff and to your patients. This will get better. It will go away. You will feel better. You will learn to cope with this disease that you have. Physicians are change agents, not just in their offices and not just in the emergency department, but also in their community. Again, remember, whether we like it or not, we're catapulted to some kind of crazy position, and when we talk, all of a sudden people do it. You have to be careful about that, by the way, because if you open up your mouth and talk, and then somebody does it, then you're responsible. I've had too many of those to tell you about. But you also have to remember that if you're asking people to change, whether it's your child to start to study, whether it's your child to click up their clothes or make their bed, when all of a sudden I'm into child things, whether it's your family to understand that you're not going to be home for Christmas this year, you have to give them a reason to change. You have to give them something that resonates with them, that changes, that they will change their life to do it. And it has to be a reason that resonates with them, not with you. That was one of the hardest things I learned, and I learned to thank God early on, was it didn't matter if it was important to me, it was important to the person who needed to change. So if I told my daughter she had to study for an exam and get good grades because she might someday go to college, and she was a teenager and she's like, really? You know, you think I'm going to college? You know, I'm going to be a professional horseback rider or something, you know. So, but when you make it important for her, then it works. And by the way, I never quote Ronald Reagan. He's not one of my favorite, but this quote was just like perfect, right? If you can't make them see the light, make them feel the heat. Give them a reason to do it. Okay? Talent scout. Remember I told you that young people will be listening to you if you tell them that they could be doctors. All right? They will listen to you. As soon as you start your rotations, you will see young people, and they will listen to you. And you need to pick out talent. You also need to delegate, which is something that was really hard for me, because I was used to doing everything. But you have to say to the nurse, can you draw that blood? Even though you could do it. You need to think about your own professional growth. When you finish med school, it's not over. When you finish residency, it's not over. When you're 5 years into your practice, is it over? No, it keeps going. And then you need to focus on what you want to do. All right. You will confront things that are astronomical. There are going to be unbelievable barriers for you, and you're not going to be happy. And so my old chief used to say, these are not challenges, these are opportunities. And I was like, oh, stop with the, I don't need the platitudes, I don't need this crap. But he was right. Boarding in the emergency department, patients waiting do you guys board many patients down here? Yeah, okay, so patients lying all over the emergency department waiting to get into an inpatient bed. How can you make that good? Well, some of us have created great academic careers. Half of my CV is about the bad things that happen with boarding, and I wrote millions of papers on this, not millions, but 50 papers or so, and so have other of my colleagues, and we've really made it a career. If you can't beat it, if you can't fix it, hey, maybe it can make me a professor, which it did. And so, you can use this. The epidemics of Ebola and SARS, horrible epidemics, but we've learned so much about how to take care of patients, about another child has appeared, about taking care of patients. We've learned how to do a better job of universal precautions. We've talked about screening. We are ready for the next epidemic that's going to hit, because it really is that opportunity. Disasters such as the Boston massacre and the most recent one in San Bernardino, amazing things we've learned about trauma. I mean, you know that no one who was alive in San Bernardino at the time they got to the hospital, actually were found alive by EMS, or were found alive in Boston by EMS. None of those people have died. None. I can't imagine the extent of some of the injuries that occurred from those two incidents, and none of those people have died. That would not have happened 10 years ago. It's simply we didn't have the tools, we didn't have the response. And then my whole thing, so I did this little project on on sickle cell patients, okay? And I was getting tired of the same patients coming in over and over and over again. And so I decided, well, why don't I just do a project on them, because that will make them more easier to take care of. That, I think some of you may know, the sickle cell population is a large population. About 10% of the population, of that particular population, are frequent, what we would call frequent flyers. Some people call them our most loyal customers. Some people call them drug abusers, okay? It's a small segment, but that small segment makes up 80% of the patients with sickle cell that we see. All right, so our life in sickle cell is not about the 90% out there that are doing well. It's about that 10% that are not doing so great. All right, so I decided to study them, make them fun. So there's a principle, I can't remember what it is. It's not, I think it's a Hawthorne principle. Anyhow, the principle is when you start doing this, they will go away. And I swear to God, it was 6 months we didn't see a sickle cell patient in our entire hospital. And we were seeing 5 to 7 of them a day. So everybody wondered what it was. It's the Schneider principle. If you study them, they won't come anymore. All right. Over the next several decades, you're going to have a lot of opportunities offered to you, both here in medicine and in your life. Everybody says, be careful what you say yes to. I say, be careful what you say no to. Some of the things I said yes to that sounded totally bizarre ended up being the best times I ever had. All right? It didn't. So, for example, I was a junior faculty member, and somebody said, I was in my first year, and somebody said the SAEM, the Society for Academic Emergency Medicine meeting, is in 6 months. Why don't you present a paper there? And I said, I don't do research. And they said, oh, well, think of something, and you could just do it. So I did. I thought of something. I did it. I presented the paper. I got hooked. The next year I presented a paper. The third year I was elected to be on the Constitution and Bylaws Committee. Such a horrible, that's I think my phone going off. Excuse me, sorry. I was a horrible committee. I know I hate bylaws, I hate I hate that stuff. From that I became on the board. From that I ended up being president of the organization, primarily because I didn't say no. Some stories. People who started out doing one thing and another, I'll just tell 2 of them. Robert Hinkson, one of my early mentors, was heading off to become an internist. Was going to go back to his small town where he grew up. Everything was planned. Along comes World War II. He gets put on a Navy vessel, all right, in the middle of nowhere as the ship doctor, bored out of his mind, and a guy comes to see him who has been using a paint sprayer to paint the boat, and the guy had gone across the palm of his hand, and he clearly had paint inside his hand, but the guy said it was the most amazing thing. It didn't hurt. I didn't feel it. I just looked down and my hand was full of paint, inside the skin. And Bob opened it up, fixed it up and everything, but he got to thinking, could high pressure actually deliver a quantity of fluid and not hurt, and not break the skin? Couldn't possibly happen, but this happened here. So he went back and he played around with the ship's, they had a couple mechanical people, and they built the first jet gun inoculator, which if any of you have been in through the military, they boom, 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 boom. And he used this not only in the military, but he's gone overseas to multiple countries and vaccinated thousands of children in these things. And he ended up becoming an anesthesiologist, but most of his life was spent doing this. He started a charitable foundation, etc. I mean, he was a guy who thought this was like the end of the earth. He was going to be on a ship's boat. What could be worse? And he ends up developing a tool that has saved literally hundreds of thousands of lives. The other one is Judas Folkman. Judas Folkman was also planning to head back to his hometown to be an internist. Had a little shop there with his dad was in practice. He was going to go and practice with his daddy. Everything was wonderful. World War II came. And they made him a pathologist. All right? Out of his residency for internal medicine, he was up now a pathologist. And he was like, this is stupid. What am I going to do? Because, doing autopsies on soldiers who have been shot is pretty straightforward. They were shot. And so he said for the first year he was totally bored, but then he began to notice that some of the older people had cancers, and that certain cancers only grew to be about, I don't remember, it was 2 millimeters or 2 centimeters in size, and then stopped. And the reason that some stopped and some didn't looked to be the fact that the blood supply didn't catch up with the tumor as it grew, angiogenesis. And so he wrote a paper about angiogenesis and said, this is amazing, because if we could figure out how to stop the blood supply to the tumor, we could stop the tumor from growing. And he shows a slide, I wish I had it, he shows a slide on the number of papers on angiogenesis in the world, and he has himself as like red for being the author. And we see it, for 30 years, he's the only person who's writing on this subject. And then suddenly somebody said, hey, this could be a cancer treatment. And of course it took off, and we now have a lot of experimental stuff looking at ways of stopping cancer by doing this. He was a pathologist. He wasn't going to be a pathologist, he was going to be a small town doc, and something happened and it changed him. So I want you to consider now, as a person, what's important to you. And if you know what's important, then make a plan to do that. You might not be able to do it now. You're in med school. I mean, that's kind of rough. Might be in residency. That's really rough. But there will come a time when you can do that. And whether that's, I want to do better for society, I want to do better for my family, I want to do better for me, that's fine. But think about that. Make sure that even now when your life is just crappy, all right, and it really is, and it will stay that way for a couple more years, not too many, make sure you take time to be with your friends, to be with your families, to be with the people who count, because that will be important to you. And make time for yourself. Even though I'm a crazy woman, that's fine. Money management, what's she thinking? You are all going to be in the top 1, or if you're a pediatrician, 2% of the population in terms of economics. And there's hardly anything you can do to get around that. And many of you didn't come from that social standard. And many of you will have a hard time recognizing that you're now one of those people that has money. Now, you're not going to be in the top 0.3%. Those people are way out of the ground. But you're going to be in that. So one of the things that often happens is when you first get money is you spend it. Because, wow! And some of these guys probably remember Tracy Domino in his first year out of residency. He bought a boat, a car, a jet ski. What else did he buy? I don't remember. He just bought everything in the world. He bought every toy he had ever wanted. And then he had to start paying on them. And he started coming to me and saying, can I work more? You know, I'm not making enough money. I bought all this stuff, you know. So just be a little bit cautious. You're going to be rich. You're going to have a lot of loans, but you're going to be rich. And you got to think about how you're going to spend that money, because it actually is finite even when you have a lot of it. And please, 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 please say no to all the bad stuff that's going to ruin your life. Someone once said to me that the best way to make sure you don't get hooked on drugs is to never do it the first time. And yet, particularly in certain areas of our specialty, anesthesia being probably the worst, people tend to use drugs. And I have known in my own lifetime probably more than a dozen people who have totally screwed up their lives. I mean, totally screwed up their lives because of drugs. And it's just like, what are you thinking? You know, we've got a lot of stuff that we can do that's legal. So stop with the crap, you know? Just don't do it. Just don't do it in the beginning. And don't download kiddie porn, please. I hope, like me, that you will spend your career and look back on it like I do and just feel absolute blessed and happy and in love with what you do. I am in love with what I do. I can't imagine doing any other thing than what I have done. Nothing I can imagine would have given me such an amazing life. However, you may find at some point that you don't love what you're doing. There's this thing there's a physics experiment with a frog. You put a frog in boiling water, he jumps out. You put a frog in cold water and you heat it to boiling and he just sits there until he cooks. So periodically I tell people, just test the temperature. Okay? What's the temperature of the water around you? You can do medicine everywhere in the country. You know, it's like anywhere. And you can do it on the weekends, you can do it on the weekdays, you can do it at night, you can do it, you know, every third Thursday. You can do it any way you want, but just check the temperature every couple of years and say, it's getting warmer, is it getting close to that boiling point? Is it time for me to get out before I cook to death? Burnout is what we talk about. That's my analogy to cooking. Every so often you just have to say, okay. And then when you burn out, the wonderful thing is there's other things for you to do. You don't have to give up being a doctor. You just do something different with being a doctor. So, madness. I'm not happy. So remember I told you my slides disappeared? They just disappeared. All right. So as you go through your life, you're going to find that there's a multitude of things that you can do. And what I want you to do for just a minute, especially since my slide is down, is think about what your legacy, what you'd like your legacy to be. So one of my friends said, imagine that, you know, I'm reading your obituary. And before I turn to page 3 to see how the Yankees did, what do you want me to think about you? What's the one phrase? Because I'm only going to give you one phrase. What's the one phrase I want you to think about? It took me a while, and I've actually thought about that many, many times, what I want people to remember me at. But when you understand what that is, then you actually have a direction for your life, and you know how you want to live it. You don't want them to say, you know, that was that guy that, you know, got in trouble with drugs. You want them to say, you know, they were a nice person. They took time. They accomplished tremendous things. They had a wonderful family. They had a great relationship in their life. What is it you want them to say? We are so, so blessed. We get to interact with people at their most vulnerable time. And we hear stories that you will never believe. You will never believe how dumb people really are. But you will never believe, and they will share these things they never share with anyone else. They will tell you, and they trust you to keep their confidence. They trust you to act on that. They trust you to be their doctor. And everyone here will have that opportunity to touch people and to make lives so much better. I wish you the best of luck ever. I hope your career is fantastic, and I hope you enjoy even 1/10 as much as I have. And with that, I will end and take any questions or comments from any of these people. So thank you. Questions, comments? Any of my kids want to talk? What's been important in your life? Family? Yeah. Bedroom.
One thing she mentioned is that it'll go by quick. I remember 10 years ago, I was in your guys' shoes, listening to speakers in my med school, and then residency goes by so quickly. It's a tough process, but it's well worth it when you're on the other side, I promise.
When you're on the other side.
When you're on the other side.
Yeah, I remember you, Pedro.
I'm sure some things haven't changed. The one thing I think she mentioned, when the med students do their ER rotations, I always bring this up. There's an ER doctor that is phenomenal, that has changed a lot of physicians, not only ER docs, but physicians and residents like whitecoatinvestor.com. Jim Daly, he practices in Utah, private practice. Just have general information, especially with our student loan debt, that the average med student these days is working. And I know the money may not be the most important thing, and that's not why you did it, but there's a reality to what you said.
Yeah.
So if you ever have a chance, just waste your time, add that to your regular websites and check.
All right. Steve, I'm going to pick on you. What's been most important?
It's been a combination. It's really three things: family, friends, and travel. I think, like everyone has shared so far, you work so hard to get to this finite point. Once you get to that finite point, then you realize, wow, there is really life after residency. So you spend most of it
Anyone else want to share anything? I so envy you guys.
What advice would you give the second years who are about to prepare for STEP and just trying to figure out their lives right now?
Prepare for what?
Prepare for step one.
Oh, for step one. It will go away. Two things. It will go away, and pass is the only thing that matters. Step one is
nice, okay? But having been on a lot of residency committees over the years, like I said, I've trained 400 and I've handpicked several. Step one, if you really score step one, it's nice, okay? But it's all about the clinical years, okay? It's all about the next 2 years. So if your step one grade is not terrific, I wouldn't want to say that mine wasn't, but if your step one grade isn't like the highest in the world, don't worry. It's not the end of the world. In fact, sometimes if you totally knock it out of the park, then we kind of get a little worried, okay? Because maybe you don't know how, if you totally knock it out of the park and you don't know how to deal with people, then, we all know what that person's like, right? And there's usually 1 or 2 of them in every class, And it's amazing because, so I was not the best medical student in my class. In fact, I was dead average. Not only was I dead average, but I was so dead average that people would come to me and ask what grade I got so they could figure out what the mean was. Because I hit the mean on every single exam the whole way through the first 2 years. It was almost cruel, okay? And I never got above the mean, and I never got below, but I never got above, okay? When I finished my last 2 years, I was near the top of the class. I didn't know anything more. It was that clinical medicine was what I was born to do. And there were people in my class who, unbelievable first 2 years. I mean, blew me away, never missed a question, unbelievable. And when they got onto the floors and they had to use that information and they had to work with people, were just, they became pathologists, okay? They couldn't work with people. And nothing against pathologists, but that's where my class people went. Because they couldn't work with people. So my answer to you is absolutely you want to study hard. You owe it to your future patients. I mean, you absolutely owe it to your future patients. But it will not make or break your career. The following 2 years will make or break your career, and if you don't have the passion in the second and the third and fourth year, then you really have to think what you're doing, because when you actually are there and ordering tests and being a doctor, even though you're in training and don't know squat, but when you're actually doing it, it's amazing. I mean, you guys, many of our residents who were amazing, even some of our attendings who were amazing, weren't really good at step one. I have to tell you, Paul, for example, won't name his last name, but you guys know the attending Paul. He was dynamite, right? And his step one score the second time even wasn't very good. So don't put too much stuff on it. It's all about what's in here. And if you've got the heart for it, step one doesn't make it. Okay? Study. But don't make it a life or death. It's not the MCAT. Yeah.
What do you like the most about practicing emergency medicine, and is there anything that you dislike about it?
Well, the best, first off, emergency physicians have the best stories, okay? Because we just see patients. I like not knowing what's going to happen. I get bored very easily. I'm a real hyper person, and I get bored very easily. I never get bored. Even if I'm sitting in a shift and nothing is happening, I don't get bored, okay? Because I don't know, 5 minutes from now, the most amazing case in the whole world might come in, all right? And so and I still love that. And I as I've mentioned to Steve, I really dread the day when I'm going to have to hang up my white coat, because I like that intensity of seeing a patient and making the diagnosis. So that's the thing I love the most is just that sort of not knowing what my day is going to be like. If I could change anything, I would change the environment that we work in. I think the crowding of emergency departments is a disgrace.
It's bad for the patients. So anything that's bad for the patients, that doesn't work for them, just makes me really angry. It's not about me, okay? I can put up with a whole lot, but they're the ones that are really suffering, all right? Yeah, I have to like trip over the patients in the hallway, but they're the ones that are laying in the hallway. That's really not good. That's another sort of piece of advice. If you keep your eye on what really matters, which is the patient, then you'll always do the right thing. If it's right for the patient, then it's right. If it's wrong for the patient, it's probably wrong. I don't know if that helped. Any other questions, comments? Again, I wish you a lot of luck. One last thing, because I now work at the American College of Emergency Physicians, and I'm a past president. One thing I will ask you to do, because for some reason I think it was one of the slides that was missing, is always make sure, whatever you do, that you join a club. That you either go join ACEP or SAEM or AAEM or whatever your club is for your professional society, and periodically go to the meetings, because it's amazing if you're just sort of stuck here, no offense, on the island, then you think that everything is like that. And when you go on and find out that other people are doing things differently, it's like ooh, I didn't know that. So always join a club and try to, get to some type of continuing education and meet some people every couple of years. You don't have to do it every year. I'm an idiot. I go every year. It's like summer camp. I see my old friends again. But always go, because you'll get out of date very fast. Very, very, very fast. Okay, guys. Thank you all for having me. I appreciate very much being here.